Hello. Have you had problems with ADHD, depression, anxiety, aggression, passivity, or other mental health disorders, and you're not having any luck with the treatment you're getting, whether it's medical or talk therapy? It's not impossible that you have PTSD. Hi, I'm Dr. Jim Porter. I'm a mental health counselor licensed in the state of Florida. I practice in Gainesville, Florida, and if you live near traveling distance from Gainesville, Florida, you can come and see me. Just look me up online and schedule an appointment. Many people come to me with a series of diagnoses, different diagnoses they've gotten from different mental health professionals. Now, this isn't just me, it happens to everybody. Diagnosis is just as much an art as it is a science, unfortunately. Even in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, version 5, is not a purely scientific document. It's based somewhat on science, which is actually making a lot of headway since the last time we published a new revision. But it's also based on committee work with a lot of different stakeholders who have different reasons for trying to find and decide what the different things are that should be called disorders and what the different symptoms or criteria for deciding if someone has those disorders are. And not only that, no human being is a particular disorder, and no set of actions is a particular disorder. These are just ways we found to try to cluster complaints and symptoms in ways that show up together a lot into names that make it easier for all of us to talk about, and easier for all of us to say, hey, I've got a real issue here. There's nothing wrong with me. There's an issue in my life, and we give it a name. Well, I want to talk to you about how PTSD can mimic other disorders. And then I'm going to talk to you a little bit about what trauma is, and then a little bit about whether you have some choice in whether or not you can get better from these disorders. So let's first say that any disorder I'm going to bring up today is probably legitimate on its own without PTSD. But one beautiful thing about PTSD, which is called post-traumatic stress disorder, trying to look at the screen and do it at the same time. Post-traumatic stress disorder is of the category of trauma and stressor-related disorders, which within the diagnosis is stated outright or implied that something happened to you in your life. For example, another one is reactive attachment disorder, which one of the characteristics of reactive attachment disorder is you've had to have inadequate parenting as a child. So post-traumatic stress disorder assumes a trauma, which it defines as, the DSM defines as a life or death or a risk to health or safety, a dangerous event happening, a physically dangerous event happening. But the science has a broader definition of what trauma can be. So let me launch right into certain things. ADHD, depression and anxiety, and anger and aggressive problems, and the inability to get things done in your life, or being what people call a victim in a lot of different relationships, can all have to do with an earlier trauma. I'm just going to go through why very quickly, according to the DSM itself. I will start down here from the bottom. Passivity. When a person has an intense trauma happen to them, they have an intense reaction. And if that's reaction causes the nervous system to wire in the expectation that other traumas like that are going to happen, they're going to keep some of the same characteristics that they had in that trauma response coming up throughout their lives, because the trauma response system is saying this is going to happen again, be on alert at all times for this danger or one just as bad to come up. So things in our environment start to be interpreted as triggers. Now, one thing we can do there are a few things we can do that fall under the category of passivity when we believe we are in danger. Now, remember, there's a part of your brain that believes you're in danger wholeheartedly. There's another part of your brain that questions it. That's why you feel like you don't understand your own behavior. But some of the things that we can get into when the fight or flight system tells us that there is a danger is hiding behavior, freezing behavior, and managing the social situation, controlling behaviors. A lot of these can look like people-pleasing. They can look like absolute social anxiety, staying inside. They can look like not being able to say no, always having to say yes. They can look like you're meek and mild and constantly sort of backed into a corner, not wanting anyone to see you or ask any questions. They can turn into the fear that anything you might say to somebody might trigger a dangerous response from someone. And so that's how we can walk around being passive. And it feels like we're passive through and through, but you know inside you that sometimes you're really courageous and sometimes you're fed up and sometimes you commit to doing something new, and then you see yourself not doing it. You see yourself asking other people's advice all the time, and who really don't know any better than you, and that sort of thing. And so that's one way that trauma can create this automatic response of passivity in you until you get treatment and work very hard in your treatment to work on it. Aggression. Again, these two are not really diagnoses. These are characteristics that a lot of people complain of. Aggression and anger and even out and out abuse doesn't come out of bad people. It comes out of people who would otherwise be good if they can learn to control their automatic responses. Now, of course, aggression is the opposite of passivity, but it's the pathological opposite of passivity. So someone who's aggressive is trying to preempt attacks, trying to warn people off, trying to control situations so that they don't get out of hand. But they're doing it by crossing other people's boundaries, by maybe actually engaging in physical assault and those sorts of behaviors. This kind of behavior puts everyone involved in a very bad position, because in order for the aggressive person to start to want to do something about it, they have to see that it's hurting them more than it's harming them. And sometimes the people in their lives have to see that it's hurting them more than it's helping them. I'm sorry. The aggression needs to be understood as hurting the person that's being aggressive more than it is helping them. But this doesn't mean that the people in the aggressive person's life need to be patient with the person at all costs. Sometimes you have to protect yourself before you take care of the aggressive person. And again, we're going to go to the issue of choice in a few minutes as to whether the aggressive person has a way out. Anxiety. Okay. In the Diagnostic Manual and Statistical Manual of Mental Disorders is the concept of distorted negative thinking, which applies to depression and anxiety, reactive behaviors, which applies to anxiety, and inability to control impulses as part of anxiety. And also something called hypervigilance, and you can have a higher base level of anxiety where maybe a normal level of anxiety is down here. We all have it a little bit. We need to have it in case of emergencies. But some of us are up here close to the threshold of triggering. We're closer. So we're always on edge. We're losing sleep. And it can catapult us into being nervous wrecks and that sort of thing. And it feels purely emotional, but it's also cognitive because it can give you messages that are self-defeating. It can also be behavioral. It can make you do things and stop doing things. For example, in a panic, people are feeling all kinds of physical symptoms. And a lot of times they're just not knowing what to do, doing about 50 or 60 things to exaggerate at the same time. Or they stop, immobilized by not being able to decide what they have to do next. So anxiety, an anxiety disorder, actually could be secondary to a trauma-induced disorder. Depression is the same thing, except for the fight or flight response. You're getting the freeze, the fold up, the check out and pass out sort of response. So depression in someone who's got it following a trauma, if it does qualify as trauma-related depression symptoms, is actually part of the PTSD criterion list. The actual wording I wish I had memorized, but it has to do with losing interest, distorted cognitions that are negative about yourself, the world, or other people, which happen to come along and make things like trying to interact with others worthless because either you're worthless, or you think they won't respond well, or you think it's pointless, or you think that the world is a dangerous, unfriendly place. And also because if you have PTSD that's been limiting your outreach enough, you start to lose track of the potential rewards out there in life, and you start to lose motivation and interest in doing just about anything, and that comes with severe depression. Well, in some cases, that's PTSD related. Now, this is the one that might surprise people a lot, but I'm just going to go ahead and say very quickly, ADHD, attention deficit hyperactivity disorder. You know what attention deficit is. It's hard to focus on one thing at the same time. Your mind goes from place to place. You have trouble avoiding distractions in your environment. And then you know what hyperactivity is, right? Hyperactivity is when you can't sit still or feel very uncomfortable sitting still. You're fidgeting all the time. You have the urge to jump out of your skin. People see you as running around like a motor. Now, I want to say in adults and in children, this behavior sometimes can be explained by a trauma. So I'm going to go ahead and explain that attention deficit. Having difficulty focusing and having distracting thoughts come up into your mind is a hallmark of post-traumatic stress disorder. Hyperactivity, when you're anxious, when you're hypervigilant, when you feel unsafe, you could have the ready to act and ready to distract yourself from your fears and your pain, feverishness going on inside you. And it can look like basic ADHD, but it could come from one single trauma in your life. So now we've gone through the list of sort of disorders and complaints that I decided to write about. I only did 5 because I try to keep these down to 14 minutes. And if I can keep them below 20 minutes, I'm very happy. So very quickly, we're going to talk about what is trauma. Well, the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, says that it involves experiencing a life and death or a situation that was a risk to your safety or life. But it also talks about, say, emergency workers who experience it secondarily. They hear people's stories about trauma, or they see people, like ER workers see people injured from trauma. And so the same with EMTs. They see a lot of death, a lot of severe injury, a lot of blood, and a lot of brand new problems that there's nothing in the medical books to solve. And so this can cause secondary trauma. You can also be traumatized by hearing about something that's happened to a loved one, just knowing it's happened to them. So it doesn't have to be a severe life and death situation that happened to you, but according to the DSM, to be able to diagnose it, it needs to be something that had a life and death aspect to it or a threat to your safety or health. Now, the trauma science and discussion among trauma researchers say there's something that you could call big T trauma, which is what I just described, and little t trauma. But let me tell you, little t trauma is not little at all. And I'll give you one example of something called complex post-traumatic stress disorder, which I believe is going to be in the International Diagnostic Manual. The ICD-11, I believe, is the one that's coming out soon or has, but is not in the American Diagnostic Manual, which is DSM-5, which I've been talking about. I will give you what you might think is the mildest case of complex trauma. Complex trauma means something being out of your control and unfavorable to you for a long period of time. One classic case is being a prisoner of war. That can be traumatizing whether or not you were tortured. Just being under those conditions of not having any freedom, being among strangers who don't have your best interest in heart, is part of it. But those are also conflated with wartime experiences too. One place that is not conflated with wartime experiences is your home. Now, Physical abuse over a long period of time, mild, medium, or severe, can cause complex trauma. But so can sexual abuse. Everybody understands that, but sexual abuse over a long time does cause complex trauma. That's different than seeing your friend blown up next to you and that being your only trauma, or being in the middle of a severe car wreck where someone you know lost a limb. That's a severe one-time trauma, and they can cause problems. But complex trauma causes something more complicated. So I'm going to go down the line here and talk about non-sexual abuse, like emotional abuse, where you're being verbally berated and called crappy and treated like garbage every day by a group of people that seem to have power over you. Parents can be guilty of this. Even pretty good parents can be guilty of this. We all need to watch out for how we're treating our children. So that's direct applied abuse. What about simple neglect? Well, simple neglect, not talking to your children enough, not being there for them just to be there with them, not showing that you value them enough, all the way to extremes like not feeding them, not taking them to the doctor when they have a medical problem. These all fall under the rubric of neglect. But apparently the simplest and apparently most innocent forms of neglect can lead the child's nervous system to believe that they are not safe, they are not valuable. The world is not a place that has anything to offer that for them. And evolutionarily, that sort of neglect used to lead in death. In fact, sometimes it still does, of course. So neglecting a child triggers a deep neurological response. Just not getting enough love often enough can trigger it, enough to impair them mildly, moderately, or severely, to the point where they can have similar reactions to someone who's been a part of a life or death situation. So that's what I'm going to say about trauma. Now I'm going to say something about choice. If my body has been programmed by past experiences to respond in these ways, do I have any choice? And the answer is, for the purposes of not blaming you, no, you don't have a choice. When someone tells you to just get over it or behave better, that is not trying to understand what you are currently going through, let alone what happened to you a long time ago. So the answer is, don't expect the world of yourself if you've had these problems for any period of time. Even if you're brand new at having PTSD, you just had something happen 6 months ago and you're still having problematic symptoms from it, don't expect yourself to just get over it. Don't expect that months of treatment are going to create a miracle cure. They're going to make you the way you were before. In fact, over time, if you accept what's happening and you do follow through on getting treatment and doing your own growth work, you can actually experience something called posttraumatic growth, which doesn't take you to the place you were before you had the trauma, but to a stronger, resilient, and probably possibly more trusting and confident place, but definitely more functional than you were in the first place. So you can come out of trauma the same as you were to some degree, meaning not better functioning, not worse functioning. You can come out of trauma worse than you were unless you dedicate yourself to getting some help and doing some work on it. And you can come out of trauma better functioning than you were if you do those things, get yourself working on it. What else is there to say about that? But yes, you do have choice. You do have choice, because the system that was damaged is only part of your body. It has to do with the memory and reactivity systems. Two of the main brain centers we like to talk about are the amygdala, which processes very severe emotions, and the hippocampus, which processes memory recall, and probably storage too. But there's also the rest of the limbic system, the autonomic nervous system, the adrenals, the hypothalamus, the pituitary, all those systems. A lot of them having to do with responses that go through the spinal cord and back out to your activity quicker than your brain even realizes they're happening. But there's another part of you, the more sophisticated brain parts, are affected, but more in the sense of atrophy, meaning that they don't get grown. They get shrunken maybe, or they don't get grown by use. Because if we're acting in these ways, we're actually practicing less choice behavior, less action behavior, less of our intellect perhaps in particular ways that involve mature responses to relationships and situations. But that part of the nervous system is there, just waiting for you to exercise it. And once you do begin exercising it, once you get past a threshold, that part of the nervous system becomes the boss. And your autonomic nervous system, the parts that are making you act automatically in ways you don't want to, will no longer have 100% control. It will more often have to ask, in a manner of speaking, permission from your more sophisticated brain circuitry. So your big brain is going to help out that hurt little child in there, and it's going to retrain that inner critic in there. It takes a lot of work, and it takes a lot of disappointment, but you can have a lot of success. The best orientation is to realize you weren't this way at birth, and you don't have to keep these problems for the rest of your life. That does not mean perfectionism, because perfectionism is a part of that system that I'm talking about, that damaged system that wants to have absolute perfection to feel safe. That's not what you're looking for. You're looking for a regular life, just to be your regular self, the one that makes decisions and mistakes and then moves on. If you have any questions, or particularly if you have any comments about any triumphs you've had dealing with PTSD, ADHD, depression, anxiety, and why don't I throw in psychotic disorders? I could explain that now, but I'm out of time. If you've had any success with any mental health disorder you've had, and you wonder if those disorders were caused by something that happened to you, please leave a comment below. But remember, this is not a confidential comment line, so you may want to develop your own confidential username. Thank you very much.